Away from home for the first time, stressed by classes, and sometimes lonely, college can be a difficult time for many students. Tonight, some Washington University students say even when they know they need mental help, they can't get it from their school. They've been complaining of long waits to get help at the school's counseling and psychological services on campus, known as CAPS. Our Nikki Torres working for you on a story you'll only see on KXLY 4. And Nikki, students they're starting to take action over this issue.
Yeah, Aaron, we spoke with some students who say they not only had a bad experience with CAPS, they also have friends who no longer go to the school because they couldn't get the help that they needed. But we also spoke with the university, which says they're listening and they are working to improve.
When you have a student coming to you saying like they're suicidal or they are extremely depressed and you don't do anything about it, you give them a 4-month waiting period to be seen, that's scary.
Students at Washington State University say they are not getting the help they need for mental health and haven't been for a while.
But I know that the wait times for people can be horrendous.
Student Maddie Lucas says she's heard of people waiting weeks and even months to talk to someone in the CAPS office.
If you're in crisis, that is too long to wait to be seen.
And she says once you do get in, CAPS makes everyone start the process over again when the semester ends.
It's hard enough to reach out for help once, let alone again and again and again.
They said I'd have to go through the questionnaire again, and if they had space available that they would get me in, but the chances of having space available were slim to none.
Student Mackenzie Dashofsky was able to get in, but she says they don't know how to handle a student in crisis.
And she said because I wasn't suicidal, they couldn't help me, and I need to seek help elsewhere.
She says her session with CAPS left her feeling discouraged.
And they really make you kind of feel like if you're not trying to kill yourself, then they can't help you.
We reached out to WSU. They say they've heard the complaints and they started to make improvements to CAPS last year.
Really tried to divert some of our resources to be able to make sure we had counselors and therapists available to take those folks who just walk in off the street who say that they're experiencing some kind of a crisis situation.
While the university's been working on improving CAPS, Lucas says she's been hopeful, but she hasn't noticed a difference.
Oh, if you need help, go to CAPS. Well, they can't see you. So we need to, it's bad to say we need to stop sending people there because they need help, but we just send them there and they don't get help, and that leaves them feeling worse.
Students are hoping things will change before tragedy happens in the community.
It's not fair to us to have to suffer quietly or get to the point where we end up ending our own lives as a result of feeling like we can't get around this.
According to Washington State University, by the end of fall semester last year, the average time spent on waiting lists for mental health services decreased from 37 days to 9 days. CAPS says its team also has more counselors for walk-in cases. It reports a 23% drop in the number of students being asked to return at a later date compared to the same period last year. WSU also offers crisis services at 509-335-2159. The crisis line is available after business hours. They're available after 5 p.m., during weekends, and during university holidays. Reporting live in studio, Nikki Torres, KXLY 4 News.